what EMS should know about postpartum risks and women's health.
Hi, my name is Keri Schubert. I'm the Perinatal Educator here at FHN Memorial Hospital in Freeport, Illinois.
And I am Danielle Wittig. I am the Perinatal Quality Nurse here at FHN Hospital in Freeport, Illinois.
What postpartum emergencies should EMS be ready for?
I think the thing we recognized the most when we started going out to see EMS providers was that they didn't realize that there were complications that occurred after pregnancy. They assumed that pregnancy and delivery was where complications ended. So hemorrhage, that people actually hemorrhage up to 6 weeks after a delivery, that the blood pressure issues, there are patients that haven't had any symptoms during the pregnancy or delivery process, but then they start developing high blood pressure and symptoms 3 days, 1 week after delivery. So just recognizing those symptoms and knowing that it's a postpartum patient. Definitely starting out with, have you delivered a baby in the past year? Or have you been pregnant and or delivered in the past year? And then even focusing, if they say yes, down further into, have you delivered in the past 6 weeks? Because the risks change throughout that whole year. Some of those emergencies would be hemorrhage, if there's excessive bleeding, whether it's during pregnancy or in the postpartum period. So that 6 weeks after delivery. Could be high blood pressure. High blood pressures in a woman of any age is concerning, but the threshold is much lower in a postpartum woman, and you might not start treatment appropriately if you weren't aware that this patient was postpartum. Postpartum depression, depressive symptoms, even suicides. Those are some of the things that we worry about in the postpartum period. Sepsis or an infection. And substance use disorder. That first year after delivery, there has been a very, very high increase in substance use disorder.
One of the big risks is going up to a scene and the patient's unresponsive. They can't tell you anything about what they're experiencing, but somebody knows something and they saw that something is wrong. So by identifying these patients with the post-birth alert orange bracelet, it takes that little factor out of it. So you can immediately start to think toward those 5 highest risk diagnoses.
Where can EMS access training and resources targeted for women's health?
I think for us, going to the very basics, one of the things our emergency preparedness coordinator has now started doing is including Danielle and I in the training for new EMTs, whether it's all the way down from a basic EMT up towards paramedics. We actually take part in the training of the OB section of their class. The other thing I do here is annually we hold an education night. So any of our EMS providers in our area, so we serve a 5-county region, any of them are more than welcome to come and attend, and we talk about information on pregnancy, postpartum complications, and then go through simulation training with that. So what would you do in a hemorrhage? What would you do in a hypertensive crisis if that patient starts to have a seizure? And just really kind of talking about what protocols are out there that they have and how would you take care of this patient best. The other thing I would say is if you don't have access to that, whoever your EMS director is, you can ask for continuing education. Every EMS station annually, I would say probably across the country, monthly has seminars, because you talk about what's going on, you use your equipment, and maybe focus one of those months on postpartum and pregnancy related complications. So just talk about what is out there, what you can use within your rig, depending on your level of care, and how to treat it. Also, collaborate with your receiving hospital. See if they do have OB educators or somebody there that would be willing to provide education to you. There's a lot of resources out there.
How can EMS trainers teach women's health with confidence?
The fear of not only learning, but training new learners on women specifically, especially when it's such an intimate subject. It's very difficult. So lean on people that know. Maybe you need to go to a different instructor that's in your area. that has experience with it. Or, as I was mentioning, what we've done is reach out to your OB team members in your area. If you have a hospital near you, is there an OB educator or somebody that is a subject matter expert that has more comfortability with women's health and those type of things, and would be willing to assist you with the training with these issues?
We have to be very sensitive to what people bring to the table as well, and what kind of traumas have they been through themselves. And so perhaps it's a one-on-one conversation with that person, but allowing that time to really get a space where you can talk about that and what makes you uncomfortable, because those are inevitably those scenes that you're going to go on. Those are the scenes that you're going to be like, great, I never wanted to see this in my life, and here we are. I met a postpartum hemorrhage, and the community that is delivering at home is also growing. So any collaboration that you can get with your local hospital is extremely important, because you can roll up on a scene that is just can be extremely traumatic. And that is something that we really do. We know it happens. We have to talk about it. And that way we know how we can kind of manage that as well.